What's up, guys? It's Jen. Welcome to Momming with Migraine. I'm not joking, I'm not even exaggerating, guys. If you have POTS, the information in this video could change your life. My channel is called Momming with Migraine, but I actually have other things, not just migraine. POTS is one of them. I also know that I have something wrong with the pressure in my head. I suspect a leak. I've also been diagnosed with high pressure. The two can come hand in hand. It's all really confusing. So as part of my quest to figure out what the heck is wrong in my head, I was watching some talks over the weekend on YouTube, as one does in their free time. A particular talk really piqued my interest, and I immediately knew that I had to make this video for you ASAP, because I know I have a ton of POTSies in my audience, and I truly feel deep in my heart that anybody who has POTS needs to know this information. Here's what, and here's why, right after the song. First off, let me go back to the video so I can pull up the slide. Here's what I'm gonna do. I'm gonna start with the punchline so you know exactly where we're going, and then I'm gonna backtrack and fill in all of the information, okay? The title of this slide is Spinal CSF Leaks Have a Troubling Similarity to POTS. Spinal CSF leaks have a troubling similarity to POTS, meaning patients with spinal CSF leaks are often misdiagnosed as having POTS. The reason that is such a big deal is that CSF leaks are understood and fixable, whereas POTS is mysterious and patients are often left learning to cope. Understood and fixable versus mysterious and learning to cope. That's fixed versus disabled. To quickly cite my sources, this is Dr. Ian Carroll speaking at the Together We Rock Dysautonomia International 6th Annual Conference. It is a video from June of 2018. He was in Nashville, Tennessee, and the talk is titled What the POTS Community Should Know, presented by Dr. Ian Carroll. Again, I will link the YouTube video below. Obviously, this caught my attention because it's what the POTS community should know, that's me, but it also talks about CSF leaks, which I also suspect for myself. I suspect a leak for myself because of my diagnosed high pressure, and I match a lot of the symptoms, and I actually physically leak out of my nose, card here. But there are differences between cranial and spinal CSF leaks. It can be a little bit confusing with the fact that I also run high pressure, but that doesn't mean I can't have a leak. And leaks in general are just really difficult to diagnose sometimes. You can have negative imaging, yada yada, just like having high pressure. And I think this talk has a ton of really important information in it. If you have it in you, you should definitely watch it. But it's a scientific talk and it's like an hour long and it's a lot of dense information. So this is some information that I think is just super important. So here it is. My computer just crashed. That's okay. So does my brain. Okay. The symptoms of a CSF leak versus the symptoms of POTS. And this is specifically spinal CSF leaks. So a CSF leak that is not in your head, it's somewhere in your spine. In both cases, you feel worse when you're upright. In both CSF leaks and POTS, a headache is prominent. Nausea and vomiting, lightheadedness and dizziness, extreme fatigue. What was the other thing? Brain fog is the thing I forgot. So those all match up. Now this one, I'm looking at my laptop here. Now this one blew my mind. Both spinal CSF leaks and POTS are associated with hypermobility disorders of connective tissue. Isn't that kind of weird? But again, guys, that very big difference is that your CSF leak is often fixable, whereas POTS is something that's a little bit more difficult to get to the bottom of. My computer crashed again. I am not saying that this is the only difference, but it is the hugest difference between the two diseases. If they're both considered diseases, guys, please don't come at me. In the talk, Dr. Carroll does go into more details about things like, well, do CSF patients tend to have tachycardia, for example? You'll have to watch his talk to get that information, but the long story short is that there just isn't a lot of information out there, and there certainly is not a lot of published research trying to connect these things together. That's why patients like us are left to our own devices so much. It's not that the doctors don't care or they're not trying. It's that these connections need to be made and then they need to be published in the literature before other doctors can really go running with that information. Let me change my battery. So I was diagnosed with chronic migraine for many years before we figured out that I had high cranial pressure. Even though at the very beginning of my chronic migraine stuff, there were signs that I had high cranial pressure. There were also signs of a leak. I was talking about my metallic taste, and I had all the telltale signs of a leak even way back then. Back then, I did not have POTS. I didn't get POTS until many years later, but I learned at the POTS care clinic that POTS is more of a symptom, not a diagnosis. Usually, if you're diagnosed with POTS, or at least in all of the cases that I have heard of, there is something big underlying, like high cranial pressure. So when I watched this talk from Dr. Carroll, and he said that patients are often misdiagnosed as having just POTS when they actually or also have a spinal CSF leak, that got like alarm bells ringing in my head. I realized I need to use this platform to tell you guys, to shout it to the world, that these two are commonly misdiagnosed as each other, so that you can decide with your doctor whether or not you should look into a spinal CSF leak. POTS, or even in the absence of POTS, those orthostatic headaches, if you're being dismissed as chronic migraine or anxiety like I was, dig around at my channel, poke around at these talks if you are scientifically minded, or go watch other stories of spinal CSF leak patients and see if your POTS maybe matches that as well, and then talk to your doctor about whether or not you should be worked up. And my passion behind this is because if you have a spinal CSF leak and it's not just POTS, then you might be able to get fixed. You might not be disabled anymore. The mere idea of not being disabled anymore, I know, is like foreign to us. It's not something that we like to talk about or get our hopes up for, but I mean, the research is emerging. We're all talking to each other, we're all sharing stories, and we are making progress, guys. So let's keep it up. Please drop your thoughts down below. Hit subscribe, hit the bell so that you get notifications, because I upload sporadically now, and I will talk to you guys soon.